911, what's your emergency?
I think about my work as a trauma surgeon and what 911 means for patients that are critically ill. Words that come to mind: safety, service, need for improvement, necessary, life-changing, life-saving.
I've always thought about it as a police response to whatever might be going on in a moment. And it could be helpful or it could be weaponized. But either way, if 911's called, your life is forever changed.
Over the past couple of years, multiple parts of the 911 system, specifically law enforcement, have been shown to be incredibly prejudiced and perpetuate harm against marginalized groups, specifically Black people and people with mental illnesses.
Calling 911 could possibly create a further problem than the one I was dealing with initially.
The reason why I did not use the emergency services available through 911 was because of the cost.
Recently been a lot of negative connotation attached to calling 911 with consistent media stories talking about fatal police encounters.
Police and other first responders are being asked to respond in situations for which they are neither properly trained nor equipped.
Now I look at 911 as broken.
But truly what we need is more resources for people to meet them where they are.
I believe that the 911 system needs to be changed.
If somebody calls, they can get connected to the right resources at the right time.
That may not be an armed police officer, that may not be a firefighter, or may not be a paramedic.
And I believe that it needs to invest in community-based first responders who know our community members and who have received training to support them in non-punitive ways and connect them to both short-term and long-term mental health care.
Where's the prevention? Where's the follow-through? What happens 2 weeks after a call is made?
911 is seen as a safety net that you hope you never need, but one that is appreciated if they respond competently and on time.
Hello, and welcome to the inaugural Transform 911 Roundtable Convening, and Lashana Tova to those of you who have been observing. I'm Rebecca Newstetter, Executive Director of the University of Chicago Health Lab and Principal Investigator of Transform 911. Here at Health Lab, we seek to partner with civic and community leaders to identify, test, and scale programs and policies with the greatest potential to improve human lives.
I'm Harold Pollack. I'm a professor at the Crown Family School here at the University of Chicago and faculty co-director of the Health Lab, and I'm also co-PI of the Transform 911 project here. 911 is often the first point of contact for people who experience a mental health emergency, a mental health crisis, or a complex family emergency, a variety of reasons. Most 911 calls are not related to a crime in progress, but an armed police response is still so often the default. And when the root challenge of so many of these calls is medical or public health, yet the response is one that involves a police dispatch. And every single person in that process, the subject of the call, the family member, other people, the first responders, the call takers, and so on, everyone is a fragile human being in a very difficult process, and we need better systems to support them in these challenging moments. And so we hope that the Transform 911 project can help shift the role and structure of our national 911 system to really reliably improve everyone's health and safety.
911 is often life-saving, yet we acknowledge that our nation's emergency crisis system, including 911, has also created harm to communities as well as to our nation's first responders. That's why Transform 911 is gathering experts from many fields alongside community members to begin national dialogue about improving the nation's 911 system. In the opening video, we heard from people all across the country expressing the importance of and the challenges that are facing our current 911 system. Over the next few hours, we're going to hear from additional perspective. What's important to keep in mind throughout both today's conversations and this work more generally is that 911 impacts all of us, and as such, transforming it should involve all of us. In Transform 911, we're taking a comprehensive look at the 911 system nationwide. We're gathering feedback from experts and community members and reviewing research to develop evidence-based recommendations for state, local, and federal policymakers in order to drive change. Through this work, and certainly today, we're trying to understand the opportunities and challenges that are facing our nation's 911 system and the emergency crisis system at large. We want to understand the underlying causes that lead people to experience crisis or to call 911 for help. We want to learn how we can best respond to such emergencies to support communities and to support first responders. I particularly want to note upfront something else that is often overlooked: the extraordinarily difficult job of our public safety telecommunicators, the professionals who answer our 911 calls and dispatch responders. They are forced to make life-altering decisions in a matter of moments, often on the basis of very limited information and also with very little support. COVID-19, George Floyd's murder, and our country's continuing racial reckoning has underscored how inequitable and how ill-equipped our emergency response system really is. Unfortunately, we have few evidence-based solutions to address these challenges. We understand that today's discussion may be hard and even triggering at points. If you want to speak with anybody, you may reach out to members of our team, Jason Lerner and Melissa Royland, who are available throughout today's convening. Their contact information will be available through the chat throughout the day and has also been provided to you via email with the Zoom login instructions. Before we get started, I want to thank the funders of today's event, Arnold Ventures and Microsoft's Justice Reform Initiative, and each of you who has joined us remotely and who will join us in the months ahead in this important work.
And I should say we're thrilled to be here with all of you today. We see so many friends and colleagues and people that we look up to. There are attendees today from all over the country. We have representatives from healthcare, academia, government, emergency response, public safety. And this is truly a kickoff convening. There's a role for each of you today and moving forward. And to set the stage over the next 2 hours and 45 minutes, a few of the many people involved in this effort will help frame the work that lies ahead and why we believe this moment offers a real opportunity for change and a real window for change. And then we'll begin to dig into the work through some work groups, and we'll explain more on that a little later.
To get us going today, I'm thrilled to introduce Dr. Thea James to set the scene for us. Dr. James is an emergency physician and has a long, impressive resume. At Boston Medical Center, she is Vice President of Mission, Associate Chief Medical Officer, an Associate Professor of Emergency Medicine, and Director of the Violence Intervention Advocacy Program. Dr. James is a founding member of the National Network of Hospital-Based Violence Intervention Advocacy Programs and was appointed to Attorney General Eric Holder's National Task Force on Children Exposed to Violence. She's a deep believer in the power of listening to patients and communities and has been tireless in her work to transform healthcare for everyone, especially those whose needs have been undervalued or overlooked in our communities. Dr. James, thank you so much for being with us here today.
Thank you, Rebecca, and thank you for inviting me here today, and thank you to everyone who's here today. You know, I'm an ER doctor in the largest safety net hospital system in a multi-state area, and you know that working in that type of an environment where the majority of our patients are either at or below the federal poverty line in terms of how they live has given me unique insight into human nature, human condition, and all really that constitutes life. It has also provided me with unique insight into the power of perception, the power of assumption, narrative, humanity, emotional vulnerability, and ultimately opportunity. But you know, deep historical narratives, as well as gaps in education, drive perceptions about who people are, what they're doing, and it actually determines what type of system-wide response to these people will be. And misperception can lead to inappropriate response, increased danger, and sometimes loss of life. But I've always thought that given any opportunity, barring mental illness and maybe substance use disorder, given any opportunity, human beings will not choose suffering. And when they call on us, I think it requires humanizing them first, assuming they need our help and treating them with respect and care. What we have witnessed in the last year and a half has revealed our challenge. And I think the challenge is to address inequity. Everyone talks about equity, but I think that the reason there's such a lack of equity is because inequity is so unrecognizable. And it's unrecognizable because it is accepted as the status quo, and so it seems normal. What is going to have to happen in order for a transformation to occur? The most important word is intentionality, and intentionality to transform. But transforming or transform 9/11's goal is much bigger than the appetite that's been seen around the country, because there are lots of pilot programs going on around the country. But transform 9/11's goal is much bigger than that. It actually seeks to create a blueprint for holistic, sustainable change across our entire nation. And the answer cannot be to send out more ambulances, particularly if they're doing the exact same thing with no transformation, no insight, and no more education, and having achieved an opportunity or aimed for an opportunity to have better outcomes. I think we have to be honest to say our healthcare system needs transforming too. Even the medical education curriculum needs to be changed. I find it to be quite irrelevant at this point because it focuses on disease, not human beings who happen to have various different types of diseases, and how to best address those human beings to get the best outcomes. And that's why we're here today, to start this conversation. But I'd also like to say that I am an optimist by nature, but it's not unfounded. I actually can see the light on the horizon, because the two most common statements I think I've heard in the past year are, we are living in unprecedented times, and I didn't know. Those statements are making reference to a pandemic and a revelation. And there's intersectionality between the two, and both give pause for reflection and honestly opportunity for a cultural transformation, including in our 911 response system. We have to re-envision transforming healthcare, re-envision transforming 9/11, including people who take the calls, and we have to have alternative community responses, and we have to have intentionality around that. And so I'd like to say thank you so much for joining and being willing to share your thoughts, questions, as well as your aspirations for transforming 911 and the nation's emergency response system. We'll now watch a conversation between my fellow emergency physician, Dr. Brian Williams, and Tanya Tucker of the Full Frame Initiative.
Hello, I'm Tanya Tucker, Chief of National Engagement and Partnerships with the Full Frame Initiative. Thank you for joining us. So as we begin to establish a vision for transforming the nation's 911 system, I am pleased to be joined by Dr. Brian Williams for what I know will be a thought-provoking conversation. Dr. Williams is a surgeon specializing in trauma surgery, acute care surgery, and surgical critical care at the University of Chicago Medicine. He's also currently teaching at the Harris School of Public Policy and has established himself as a leading advocate to eradicate racial inequities in healthcare. Being a surgeon and a community activist, and certainly I think just living your life as a Black man in this country, you probably understand the connections between public health and public safety and public policy, community safety better than a lot of people. And so for those that really don't see those connections, how do you see public policy affecting something like public health or community safety?
Well, when public policy is weaponized, vulnerable communities suffer. And I think we've seen that happen quite a bit throughout the COVID pandemic, how inaction with health policy can lead to death, how misapplication of policy can lead to death and suffering. So what I wanted to do, and I wanted to continue going forward, is to take my clinical experience of working in the hospital, my academic experience of knowing how to review literature and talk to academics about the latest research on a number of different entities, and kind of merge that with policy.
And Transform 911 has brought us all together today to create this vision and begin the work to actually move us toward a more equitable and safer 911 system. And so we want to identify what are the changes needed to improve the health and safety outcomes when someone's in need of emergency assistance. So what are some of the ways that you see the 911 system being able to actually decouple enforcement and care?
Yeah, I've learned a lot just talking to the Transform 911 leaders about this. Because even though it's impacted my life on a daily basis, I didn't think deeply about how enforcement and care are coupled. As a trauma surgeon, when someone calls 911 for, say, there's a gunshot victim or a motor vehicle collision victim, they're calling to have someone come there to help them and bring them to the hospital to get treatment. I personally had someone call 911 because I was standing outside my apartment and they said there was a bald black man acting suspiciously. So in that case, 911 was used to enforce. So I like what Transform 911 is doing about trying to decouple those two issues and try to get towards a more equitable use of the system, because we know how 911 can be used to enforce, how it can be misused, and it certainly had led to the deaths of innocent people over the course of many, many years, as we've seen happen in the past.
I want to ask you sort of today, as you think about 911 today, what words come to mind about that system?
Thinking about 911 today, words that come to mind are safety, service, need for improvement, necessary, life-changing, life-saving. As you can see, there's some positive words there and some areas for improvement. But overall, I would say I have a favorable opinion of 911. And because I'm advocating for transformation and improvement, should not be construed as dismantling the system. It certainly does a lot of good for a country. It has led to saving many, many lives, but we definitely need to address this issue where care is coupled with enforcement. And if we can decouple those, that will go a long ways towards improving the system overall and really having a much more positive impact on a much larger portion of the population.
Thank you. I think those are definitely words we can continue to work toward in the future as we come together and look for ways to transform the system. I really want to thank you for spending some time with us. And thank you for all the work you do inside the hospital, inside the classroom, inside communities. We are grateful for you. Thank you.
Thank you so much for that humane conversation. It's my pleasure now to introduce my former student and now colleague and co-author, Lindsey Leininger, who's a professor at Dartmouth's Tuck School of Business, where she specializes in the use of public health data. And Professor Leininger will be moderating today's panel. It is so I won't embarrass the rest of you by reading her CV, which will just bring out our self-esteem challenges. But she teaches public healthcare leaders how to make intelligent use of medical and public health data, and that's such a core opportunity right now, mostly untapped, when we provided by our 911 data and response system. And Lindsey, please take it away.
Well, thank you, Harold, for the incredibly kind introduction. What a treat to be here today. It's a privilege to be part of this conversation. And without further ado, it is my honor to introduce our distinguished panelists. I am actually going to read their short biographies word for word because I don't want to miss anything. I want to appropriately showcase their amazing accomplishments. So Jerry Clayton, he is the sheriff of Washtenaw County, Michigan. He's more than 30 years of experience in public safety. He serves on the boards of several local organizations focused on children, mental health, and homelessness. Welcome, Jerry. Katya Fels-Smith is the founder and CEO of the Full Frame Initiative, a social change organization challenging assumptions and changing structures and systems so that everyone has a fair shot at well-being. We're so glad you're here, Katya. Walter Katz, Vice President of Criminal Justice at Arnold Ventures. He has an extensive background in law enforcement, accountability, and oversight, including overseeing police reform efforts here in Chicago. Thanks for being with us, Walter. And last but certainly not least, we have with us Moki Macias, Executive Director of the Policing Alternatives and Diversion Initiative in Atlanta, which fosters a new approach to community safety and wellness by providing an alternative to punishing people for what they do to survive. Sincere thanks to all of you for being with us today. And Jerry, for better or for worse, I'm going to kick things off with a question for you. And thank you for your grace in advance for my just being direct to get us started.
Okay.
So forgive me again for my directness, but from your position and your seat as a law enforcement official and leader, do you think 911 is serving the public well and public safety officers well? We would just love to hear your insight.
Sure. Well, I think there's two sides to that coin. I think 911, the service adds great value and it contributes to our efforts to co-create public safety. We should be trying to co-create public safety with the community. But there's another side to that coin. I think there's harm as a result of how 911 is used. And if we really think about the history of 911, it's really serving pretty much as it was intended by the Johnson administration after the Kerner Commission. In that report, there was a recommendation to have a nationwide number available to the public that, amongst other things, quickly mobilized police to respond to civil disorder, right? So that was done right after all the disorders, civil rights movements in these cities. So that's what the original intent of 911 is. It's evolved tremendously over the last 50 years in many meaningful ways. I think except in certain areas, and that is really areas of examining some of the basic assumptions that drive 911 culture, how it's used by government officials and others in the public that has resulted in discriminatory acts towards people of color and other marginalized communities. And quite frankly, there's harm, not by 911 specifically, but how it's being used by others and the lack of examination of the impact of 911. So it's a complicated question. I think we need 911. We need to continue to evolve in the right way. And that's why I support this effort of transforming 911.
Jerry, so appreciate your insight. I really am grateful for your bringing up the history of the system and how that has very long arm into its unintentionally harmful impacts today. And, I want to kind of pull a thread here. You talk about co-creation, and Katya, I want to send this to you. Your work really focuses on shifting systems, their mindset and their outcomes, those who mean to help people but unintentionally cause harm. And you really have a vision for helping co-create better outcomes. And I would just love to hear you talk a little bit about your work.
Sure, and I'll tie it obviously expressly to 911, and thanks so much for having me here today. I think my work, and I'm guessing that for a lot of us who are gathered here today, we're hungry for evolution in our country towards a vision of everyone having a fair shot at well-being. And I think about what many of us tell our children, what certainly I was taught as a child, which is when there's an emergency, call 911. And the reality that for some people, calling 911 is a pathway to greater access to well-being. And for too many people in communities, even before picking up the phone, there is a whole separate calculation about whether or not this is going to be a pathway to well-being and what the costs are. And the fact that it is not random who makes those calculations, right? That racism matters, that income level and asset level sort of matters in people's calculation, tells us that there's something wrong. And I want to be really clear here that this is not about just that, oh, we just need to train operators differently. This is not about individual operators. This is about systems and structures and history. I also want to say that this is, to me, the opportunity here is to recognize that 911 it's not that these are issues just for 911. They are issues in systems across our country. But what is unique about 911 that we've been hearing is that it affects all of us. And two, it is the nexus of so many other systems. It is a constant interface between individuals and these massive systems. And so changing and transforming 911 requires transformation in community with community, as well as transformation in some of the most powerful systems in our country. And that is an opportunity.
Thank you, Katya. I really, I appreciate you talking about, and really everyone bringing forth kind of three themes that we keep hearing, the social patterning of harm from this system. And there's a hunger for change and indeed a need for change. And it's going to take some real changes at the systemic level. And Walter, I want to bring you into the conversation now because you've served in these systems for much of your career, in addition to your current role in philanthropy. And I would just kind of like your high-level impressions on what we know, what we don't know, and what are the blind spots to catalyzing systemic change in 911.
Well, I think at the top line, thank you so much for having me, first of all. At the top line, we know a little and we're starting to learn more. We're getting a better idea now, for example, what the volume of calls for service are and the types of calls that are being made and how police are spending their time and what they're responding to. So we know that, for example, police are dispatched to calls about crimes of violence in progress, really only in single digits. A larger percentage are for disturbance calls. A surprisingly and troubling percentage of calls are for suspicious persons. And what are the implications of that? So we're learning more about that front end. We don't know as much about outcomes, though. And one of the challenges there is that the ability to tie together, let's say, call for service data with public health data, with criminal justice administrative data is really difficult for a number of reasons. But those challenges make it really hard to really assess what are the benefits and the costs of our response system, right? And 911 is just one facet of that response system. It's the focus of our conversation here today as we think about what occurs when somebody who's in need, who's in crisis, is calling for help, what kind of resources are distributed, which is a different type of question. Is like, for example, when one wants to make a phone call about there's a suspicious bald Black man standing outside of the apartment building. It's that type of phone call which directly led to the death of Elijah McClain in Aurora, Colorado. It's that type of phone call which led to the death of Tamir Rice, where ultimately there were some communications gaps, rather hasty conclusions reached by police officers, and Tamir was dead. So there's a host of areas for us to explore the benefits and the costs. We're learning more about the harms, but more needs to be done.
Walter, I really appreciate, as a data analyst and data educator, you bringing up the theme that service fragmentation means data fragmentation. So even our data systems aren't serving communities well when it comes to 911. So Moki, I'd really like to turn this to you because I look at your work in Atlanta with hope, and I would just really like to hear your lessons learned. What kind of lessons from on the ground can you share with us to help us bring forth and hopefully institutionalize?
Awesome. Yeah, thank you. And, we're fairly early in our work in Atlanta, but I do hope that, as we continue to learn alongside our public partners, that we can be in conversations like these with colleagues around the country. So I appreciate the opportunity. I think one of the key aspects of this is that we do not, sounds a bit scary, right? It sounds a bit like we want to change it all, right? But I think what we've done in Atlanta is been okay with the fact that some of this change needs to happen incrementally, right? We need to bite off piece by piece. And in fact, I think the benefit of doing that is that we are bringing community along with us, and we are not leaving them on the sidelines as we develop new ways of responding to concerns in community, right? So in fact, we have to both respond to community needs, right? There's a public demand for a shift in the system. And at the same time, we have to shift expectations of what the response looks like, right? So we're both responding to a demand that already exists, and we're also trying to move folks away from the idea of, well, the default response to a lot of concerns is enforcement and punishment. So in Atlanta, we partnered with our city of Atlanta, our city 311 line, in order to start recruiting some calls related to quality of life concerns actually out of the 911 system in order to address people's concerns in a different way with different responders. The way that connects to the work that we're talking about here today is that while not yet changing 911 directly in Atlanta, right? This initiative and this partnership and the experience community members have had with being able to call a public service line and get a different kind of response has built both public confidence and also, I think, political will for reimagining what our public service lines look like, right? So really, I think the key lesson for us at this point has been taking a bite at the apple and then figuring out how that sort of opens the doors to more conversations about what people actually want and need from our systems.
Moki, I love the quote, taking a bite out of the apple. So, I have the privilege of teaching and supporting a lot of entrepreneurs, public health entrepreneurs in my current role. And I say the early work is the courageous work. And so I just want to thank you by leading by example, by doing the early and courageous work to be an innovator in your place. So we have some questions from the audience. I'm going to read them and we're going to get our panelists' views. I also would like to encourage the audience. We want to hear you. We want to hear your voice. So please don't hesitate in sending in your questions as the conversation keeps going. So Kate Elkins, thank you for your question. What EMS and 911 stakeholders have been involved in your to date in your work? It's critical to have engagement with those actually in the field for this discussion. 911 is not simply a way to dispatch police. And so I'm going to kick this. I think I'm going to kick this to Jerry, actually. Jerry, who ideally would you want involved in this work? Who needs to be at this table holding hands with you, trying to figure out a better system?
Sure. So I won't talk about it from the research perspective that Rebecca is leading. I'll talk about it from the practical perspective. So in our county, as the county sheriff, we're also responsible for our Metro Dispatch, which addresses over 95% of the emergency calls that come into our county. As we have talked about how do we evolve and recreate the system-wide approach to serving people and co-creating public safety, you need to have all the partners at the table. So not just the police services and fire, but as we've started to think about what we call a community of, a continuum of community responders, so who's responding to situations and crises in our community, we have to look at that broad spectrum. Our mental health partners, our public health partners, our social services partners, and quite frankly, one of the first groups we reached out to was our dispatch. We talked to our leaders. We're doing focus groups with our dispatchers to understand currently what they're experiencing and what the barriers are, and quite frankly, what they need in terms of information to appropriately dispatch to the right responder, given the information that they're receiving. And oh, by the way, let me add one more. The end users. So you have to reach out to community members. If we're co-creating public safety and co-creating the systems to create public safety, then you must reach out to those that are on the receiving end of those services. When we think about mental health, we reached out to folks that had lived experience. What's your current experience when you call 911 and the response that you get? What is the experience that you desire? So I think all of that, the bottom line is this: we have to move out of this siloed approach, thinking that there's only one answer, and really try to engage a continuum that is comprehensive and has very specific outcomes that I think add value to all of our community members.
Jerry, thank you. Moki, I would love to hear if this resonates for you as someone who is literally putting together the table and trying to get people in the seats. What are your reactions?
Yeah, I think that's critical. I couldn't agree more. You know, our work started out with and continues to involve a close partnership with the police department. So we provide an immediate alternative to arrest through law enforcement assisted diversion. And that means we're in conversation with police officers every day about what they're encountering. And what we've seen from officers is that, you know, the majority of the calls that they respond to or the community requests that they respond to are related to issues that they are not necessarily most equipped to address, right? And we've heard that before from Sheriff Clayton. So, you know, I think that really understanding from officers what they encounter every day and, you know, in the day-to-day is critical. At the same time, hearing from, I totally agree that, you know, we need to hear from the dispatchers. For us in the work that we're doing, we're speaking really closely with the 311 call takers. And, you know, I think that that has given us some insight into the kind of issues that call takers have to deal with, but really, you know, understanding that they're receiving really limited information. They have to do it in a very short amount of time. And it's really critical for them to have a full understanding of what their universe of resources are, right? That we understand that 911, you know, any of our call lines are sort of the doorway into the resources and infrastructure that exists. And they really need that kind of understanding to be able to provide the appropriate responses. So I think it's critical to understand where the gaps in both understanding there, as well as what do they believe is really going to transform people's experience when they do call.
I'm really grateful to you for bringing forth this experience of the people on the receiving end of the calls, because if we think of them as truly critical in this process, we must amplify their voice and understand what they're doing better. Katya, I want to kick this to you now, because I know that you really are focused on getting a voice and amplifying the voice of the community members or the end users, the phrase used earlier, of these services. So, you know, when we're at this table and we have all the right people there, how can stakeholders best listen to and best use and build on the skills from the community in these types of conversations?
I want to address this in two parts, actually, if that's okay.
Of course.
One is, and I'm watching I will say that I have been sort of occasionally scanning the chat, and there is some pretty lively discussion and feedback in it. And at first, to the person who called me out for using the language of operator, thank you. Telecommunicators, call takers, you are absolutely, your role is bigger and than what I implied. So thank you, because this is part of what the work is, right? Is being straightforward and honest. And there are certainly folks from the industry who are involved in this effort, and you'll be hearing from and working with them later on. I would say, please come to the sessions later, the breakout groups, and bring your voice there. And if you have something to say, this is the kickoff of an initiative for voices from around the country. And that there are multiple communities to be engaged in this. Now, to the point of those who are, when we talk about the community, what that often means are folks that, particularly folks that have been often negatively impacted by a system or who have disproportionately suffered the harms. I think that anytime we're working with any community, and this also includes telecommunicators and others, the first thing and the most revolutionary thing that we can do is to start with what's working. And to stop and pay attention to all the ways that people are making things work, often in spite of systems that have been not set up to make it easy to make things work. All the calls that could go wrong, that go right. And let's learn from that. All the things that those in communities where folks aren't calling 911 so much, or where 911 has had a mixed record, or what has been dispatched has had a mixed record. There are workarounds that people are doing. There are alternatives that are growing up from community. There are ways that folks are making things work. And I don't want to be a Pollyanna about it and say, see, everything's out there. But so often in our attempts to change something, we bulldoze over what's working, and we bulldoze over the energy, and we forget that there are folks that have been working so hard for years, decades, even generations to make this right. To me, part of the opportunity we have through Transform 911 is to lift up, partner with, and crystallize these together into a shared vision. And that is really going to be hard, because as also is evidenced in the chat, 911 is not a unified system across the country. It's one number that we're all supposed to call, but it's thousands of call centers and lots of different rules, and they're located in different sort of places, not just physical places, right, but different agencies within different jurisdictions. And so there also is a need to listen locally, not just nationally to what we do, but locally, as Moki is doing, as so many other colleagues, so many who are joining us today are already doing. And so I think that, again, challenging, but really an opportunity for doing things differently in a spirit of partnership. And a focus group is not a partnership. A survey is not a partnership, it's input. And the work of partnership is the bi-directional listening and learning that needs to happen. And that is going to be hard throughout this. But I think that there is a moment and a will to really doing that.
Well, Katya, thank you for your candor, and also thank you for the nudge to reframe, right, towards assets and strengths. I think that often gets, I needed that nudge. I really appreciate that. And I think that that's a better center to stand on. So Walter, there are some very interesting questions in the chat that are coming through the wire about research. And I'm not going to put you on the spot with respect to nitty gritties about any one particular piece of research, but I would love to hear your vision for putting data into action, evidence into action. When we have our big dining room table of everyone who needs to come together to talk, my hope is that researchers and their funders and their champions are there too. And I would just like to hear your vision for what that might look like.
Well, when we say research, we don't necessarily mean data, because research is broader than the data itself, right? And for example, analyzing call for service data would allow for a quantitative analysis of, for example, what percentage of calls is being dispatched where, for example. But I think the qualitative research is also really important. And the qualitative research could be ethnographic research, it could be focus groups, it could be actually sitting down with people. And that's why at the very top is that the important thing is, first is the problem identification. So we can weigh the benefits and weigh the costs. And the only way that you can do so is through really robust research, but of a broad range. And that research has to include, and the problem identification has to include listening to a broad range of people, rather than coming from a frame that there are harms. Yes, there are harms, but also weighing it against what the benefits are. You can only understand that not only by talking to people who are in communities, but also talking to people who are at the front lines every single day who are doing this work. That includes officers who are in patrol cars, includes fire and emergency response, and also includes the call takers and the people who are dispatching the calls. So, we are doing, we're supporting the work here of Transform 911. We are supporting research, for example, in North and South Carolina, which is analyzing 911 call data to create more tailored responses. And we've also supported research in the past, which has done some of that transformative research that Rebecca Newstetter has led. So that work will continue, but that is just to inform the policymakers and community members and other academics about building that evidence base as we move forward to understand where is transformation needed? How do we reduce harms? How can we better outcomes for people in our community?
Thank you, Walter. And I'm going to add the friendliest of rebuttals that I think all of that's data. I have a pretty creative definition of data, and I think those doing community-based participatory research are really innovating with respect to how we eggheads better conceptualize the knowledge and the insights of the grassroots and systematize it into science. So I think it's a really important leading edge of science and practice. So Walter, thank you for being part of that energy and that mission, right? Because listening is not just about skill or empathy, it's also about science. So I just really appreciate your comments on that. So there's a comment in the chat that I'd like to get the panelists' reaction to. It's about dispatch and EMS providers trying to bridge the gap between 911 and healthcare, right? And integrating hospitals into 911 systems. This is tough, right? It's hard to get the systems to work together and talk together. Do any of you on the panel have experiences, lessons learned, best practices you can share about this particular service fragmentation and bridging this particular gap with hospitals? No, oh my goodness. I think the silence might actually be a powerful testimony to the fact that this is a real need. And this really goes to my heart of hearts too, as a public health researcher, that kind of breaks my heart that we don't have a lot of lessons learned yet. So I certainly hope that healthcare safety net administrators are included at our dining room table as we spark change in the systems. Jerry, I would really like to hear your perspective. I'm really holding your words and Katya's words in my mind at the same time and trying to contextualize them with each other. I would love to hear successes, lessons learned you have in successfully engaging people in your community and grassroots innovators in your community. Because I know there's some wonderful stories in the media about your work on this, and I would just really like to bring them to this audience today.
Sorry. Yeah, I think it all starts with deep partnerships. And for us, it didn't just start because of some single crisis. Part of our organization's core values is, community leadership is about community engagement, identifying partners and working together with partners. So we start with this strategy, drive structure, mission, drive strategy, drive structure. So we intentionally engage different stakeholders to have conversations around what their vision is around the outcome of services, understanding that people are bringing different perspectives and they see the world from the seat that they sit in, and we have blind spots. So we try not to go in with assumptions. We try to have them with an open mind, and then have these discussions around what kind of outcomes do we want, and then start to talk about what strategies we need to put in place to get there. So you mentioned this thing around hospitals and EMS. One of the things that we've done is we've reached out to our EMS partners, brought them in early on. And I think there was a comment around, if you really want to engage folks, don't wait until after you put something in place and then bring them after the fact to the table. And I think they're 100% right. So what we have tried to do in Washington County is right up front, identify all the different stakeholders, bring them to the table as we're trying to identify the outcomes, and then let those outcomes drive what we do. And I'll just add one more piece. I think especially in the public space, there's always challenges because we start with the money first. Well, we don't have a budget for this, so there's no money for that. And once you start there, you restrict your creativity. You must start with outcomes first, and you must have everybody at the table to develop the right strategies, and then you pursue the dollars to make that happen. So I don't know if that covered what you were looking for, but from our perspective, that's just the approach that we take.
Jerry, I think that's great. And unfortunately, that's the last word for this panel because we have to move along the program. I just want to say it's been a joy to listen and learn from our panelists. I am impressed and humbled by the work that you do, and I'm so excited to have your energy as part of this convening. So thank you very much. And Rebecca, I'm going to kick it to you.
Thank you so much, Lindsay, and thanks to all of our speakers and to all of you participating in this conversation with us virtually and through the chat bar. We really appreciate all of the work and the important issues that we're bringing up. I just want to highlight what's been said before. This is a kickoff conversation. We don't have all of the answers. We don't have all of the right people at the table. The intention of today is to try to make sure that we do and that we are learning from all of the important work that's already happening in this space. So we're looking for people who are interested in participating in this conversation. If we want people to join us in the conversations and in the work ahead, to educate us, to join us, to learn together with us. So we're now going to head into the breakout sessions where we are going to start to do that work together in what we hope will be a multi-month exercise as many groups and people together participating and learning and growing recommendations across the field. But first, I want to tell you a little bit more about this effort. Through this event and through our growing community of practice, we're formulating blueprints and policy recommendations to help improve response systems across the country. Over the next month, 6 work groups will be digging into this work together. We have really outstanding co-chairs from health, EMS, 911 dispatch, community response, law enforcement, community-based organizations, and more, who are going to be leading about a dozen or so people in each work group from around the country to answer and contemplate and recommend around certain questions and to develop a chart and path forward. The 6 work groups are represented by each of today's breakout sessions, and these include the 911 call handling operations, 911 governance, 911 hotline alternatives, alternatives to first responders, public safety telecommunicator professionalization and supports, and 911 technology infrastructure. The breakout sessions that follow will be led by the current co-chairs of these work groups. The work group membership is still being finalized. One of the main goals of today's event is to listen and to learn and to bring people on board to help join us in this work. We invite you to join, and by doing so, you can look at our website, transform911.org, or transform911.org/work groups if you'd like to learn specifically more about the work groups and to volunteer. The following breakout sessions are designed for you to learn more about each of these topics and for us to learn more from you. We have a very limited amount of time. Again, this is an event in which we are trying to bring people together. Each of the breakout session blocks will have 2 topics running concurrently, facilitated by the co-chairs. All of the sessions will be recorded, as is this full convening, should you wish to refer to the discussions in the future, or if you're having a hard time deciding which breakout session to attend. We'll invite you in just a moment to please click on the link to join the session of your choosing. You'll have a few minutes to grab a drink or to use the restroom. After our 3 sets of breakout sessions today, we'll meet back here for a few closing remarks. And if you have any questions or difficulties in accessing the breakout rooms, please contact Thanvi Hatharamini for technical assistance. Her contact information is in the chat and was also provided to everyone via email. Again, we thank you for joining you, and we thank you for joining us, and we really look forward to hearing from you throughout the day and in the months ahead.